Imagine your heart, a tireless worker pumping life into every cell. Yet what if this vital organ were secretly sabotaged, its very essence corrupted from within by an invisible enemy? And the worst part, this enemy might be lurking right under your nose. Now, picture this. This isn't just a scene from a thriller. It's the chilling reality of endocarditis. Exploring the silent erosion of heart cusps that can lead to sudden life-threatening failure. When it comes to understanding the human body, there's no room for guessing. We believe in evidence-based knowledge, up-to-date information, because your health journey should be paved with the right information. That's why we've designed our videos to be both educational and engaging. No fluff, just clear, concise explanations that empower you to make informed decisions about your health and well-being. So don't hesitate to share your thoughts, questions, or suggestions. When it comes to the heart, time is of the essence, and this condition doesn't wait. Get ready to discover why speed is crucial in tackling acute infective endocarditis. Prepare to be captivated as we explore the intricacies of this condition, acute heart failure, and even death if not recognized instantly. But before we move further, please take a moment to subscribe to our channel. We're excited to have you join us today as we continue our exploration of the cardiovascular system. These normally harmless bacteria can wreak havoc when they enter the bloodstream and attack the heart valves, leading to a condition known as endocarditis. Our team of experts will guide you through the ins and outs of this condition, helping you understand its causes, symptoms, and treatments. Whether you're a student, a healthcare professional, or simply someone who wants to learn more about their health. So, what exactly is endocarditis? This infection can cause the formation of growths, known as vegetations, on the valves. The condition typically affects people who have pre-existing heart conditions or who inject drugs. Bacteria such as streptococcus and lactobacillus are commonly found in our mouths and are generally harmless. This can happen if a person has damaged heart valves or other risk factors, such as intravenous drug use. Once in the heart, these bacteria can multiply and form vegetations on the valves, leading to endocarditis. However, understanding the potential role of oral bacteria in endocarditis can help raise awareness and promote preventive measures. Maintaining good oral hygiene, seeking dental care, and avoiding activities that increase the risk of bacteria entering the bloodstream are crucial steps in reducing the risk of developing this condition. Furthermore, individuals with pre-existing heart conditions should take extra precautions to prevent endocarditis. This includes taking antibiotics before dental procedures to reduce the risk of infection. By understanding the link between oral bacteria and endocarditis, as we continue to explore the world of cardiology with you, we want to remind you that knowledge is power. Thanks for tuning in today, and we look forward to continuing this journey with you. Before we continue, please take a moment to subscribe to our channel. Next up, we're going to talk about what happens in the body when this condition strikes. The immune system rises to defend the heart against the barrage of pathogens. But as the battle rages, damage is done. As the infection progresses, the heart faces catastrophic regurgitation as blood flows backward, overwhelming the system and leading to acute heart failure. If left unrecognized and untreated, this can lead to the swift and unexpected demise of the individual. Quick action can curb the infection's spread and avert the threat of death. Our immune system is a vigilant protector, always ready to combat foreign invaders. As the battle intensifies, the infection continues to spread. The once efficient system begins to falter, struggling under the weight of the relentless assault. The stakes are high, and the need for intervention becomes increasingly urgent. The body requires immediate medical attention to stop the infection's spread. Medical professionals are equipped with the knowledge and tools to combat the infection and restore order to the body's internal defenses. Understanding the complex interplay between infection and the body's response is crucial. Now that we've covered the battle within the body, their strength and resilience may be evident, but subtle indicators of fatigue and weariness betray their struggle, often accompanied by a feeling of intense fatigue or weakness. It's as if the heart is calling out for help, signaling that it's under siege. Below, the labored breathing and exhaustion hint at the struggle to pump blood effectively, hinting at the heart's weakening state. And these murmurs can signify the turbulent flow of blood around the infected and damaged valves. And if the battle reaches a critical point, the consequences can be dire. The blood flow becomes so disrupted that the body's organs begin to shut down. It's as though the city's power grid has been compromised, plunging essential services into darkness. In essence, the battle against acute endocarditis is waged both internally and externally. While the immune system and heart valves are the primary battleground, the body provides visible and audible cues to alert us to the unfolding drama. Now that we've explored the signs and symptoms, it's time to discuss the invisible enemy, the microbes causing this treacherous attack. Much like a detective investigating a crime, we must identify and understand our enemy to develop effective countermeasures. Leading the charge is Staphylococcus aureus, a notorious pathogen that often acts alone, causing significant damage. Particularly concerning is its tendency to strike those who inject drugs, highlighting a vulnerable population at high risk. But S. aureus isn't the only offender. These partnerships complicate the defense strategies as multiple enemies require coordinated countermeasures. A collection of bacteria known for their tenacity and ability to evade detection, making them formidable opponents. Understanding the tactics and resilience of each microbe is crucial in formulating targeted defenses. By unraveling the secrets of these microbes, we can develop more effective strategies to protect the heart and safeguard our health. Finally, let's delve into the most crucial aspect of combating this condition: diagnosis and treatment. Imagine having all the pieces of a complex puzzle. Medical professionals must consider various factors. They meticulously analyze each piece of information to reach an accurate conclusion. Doctors use a checklist known as the Duke criteria to evaluate the evidence for this condition. But that's not all. Echocardiography helps assess blood flow, detect abnormalities, and identify any vegetation. But the road to recovery doesn't end with diagnosis. Effective treatment of endocarditis requires a multifaceted approach. The choice of antibiotics depends on the severity of the condition and the suspected causative organism. The duration of treatment can vary, depending on factors such as the. However, it's important to note that not all cases require prolonged antibiotic treatment. By combining the precision of modern medical techniques with the expertise of healthcare professionals, this step brings us closer to a definitive diagnosis and effective treatment plan. The journey may be complex. Now, let's shift our focus to a real-life patient story. A patient is rushed to the emergency department, their condition critical, their future uncertain. With every passing moment, the clock is ticking. As the medical team springs into action, the story unfolds. Through this immersive experience, we witness firsthand the urgency and complexity involved in managing endocarditis. In the operating room, the stakes are high, as surgeons perform a delicate operation to repair the damaged heart. The rhythmic beeping of monitors fills the air. We gain insight into the extent of the damage caused by endocarditis and the innovative techniques used to restore the heart's functionality. The skill and precision of the surgical team are on full display as they work tirelessly to save the patient's life. Throughout the ordeal, the patient's family anxiously awaits updates, their hopes and fears palpable in the sterile environment. The emotional toll of the situation is just as intense as the physical challenges. The outcome serves as a testament to the power of medical expertise and the resilience of the human spirit in the face of adversity. From the initial symptoms to the life-saving surgery, endocarditis is a formidable foe, but armed with knowledge, vigilance, and advanced medical interventions, we can stand strong against this silent menace. By embracing a proactive approach, remember, understanding the enemy